You're on Larrakia Radio, 94.5 FM, and in the studio, my name is Caleb, and today we have a lovely guest joining us today, all the way from Alice Springs. It is Pat Turner AM, who's joining us today to talk about a few of the things that are going on with Danila Dilba. As well, we'll be having a bit of a chat about some of your illustrious past, I have to say. So thank you for joining us today, Pat.
Well, my pleasure.
So first up, you've been brought into Darwin, I think it was late last year,
Yes.
to discuss some things with some of the members out there for Danila Dilba. So what was your role at the time with that?
The Danila Dilba board asked me to come and look into their concerns that had been raised and to report back to the Danila Dilba board. The process I followed was to, first of all, get a briefing from the board members who were available from Danila Dilba on what the issues were. They wanted an independent person to come in and take a good hard look at it and give them advice on, how to fix things if they needed fixing.
Were you brought in on the suggestion from these members or from the board itself?
No, from the board itself.
Okay, so you're a completely separate entity from the company itself?
Absolutely.
So what were the biggest issues that were brought up during this?
Well, according to the concerned community members, they were concerned about the identity of the chairperson, the then chairperson of Danila Dilba Health Service. They were also concerned about what they considered to be a decline in service delivery, and I'll come back to that.
Okay.
Also a decline in Aboriginal staff members at Danila Dilba, and a decline in the counselling services that were available. Some thought that there'd been a loss of community control and focus by DDHS, and they had some governance issues. So I identified those as the key issues, and I reported to like I said, I gave a preliminary report to those concerned members, which addressed those issues. I acknowledged that the identity of the chairperson had to be resolved once and for all. That in terms of the other questions that they had raised, like a decline in service delivery, well, in fact, the opposite is happening at Danila Dilba.
In what way?
Well, for a start, they've had a vast increase in the number of episodes of care over the last 5 years. So in 2009-10, they provided 29,770 episodes of care in Darwin. In 2014-15, they provided 58,000.
Wow, okay.
376 episodes of care. So that's not a decline in services. And an episode of care is a unique visit to one of the Danila Dilba clinics, and each visit may involve accessing one or more of the service providers at that clinic. So you might go and see the doctor, then you might see the nurse, or you might see the counsellor, all of those separate interactions with the health service staff, where it's healthcare related, is an episode of care. So Danila Dilba's client numbers in 2013 were 11,376 in the Yiliriang region that they service. In 2015, it's 15,360. So people are voting with their feet.
Yeah.
Right? So there's been a marked increase besides that in terms of, decline in service delivery. They've opened the new clinic at Palmerston last year, and they'll be opening the clinic to put GP services at the clinic in Malak by mid-year.
Yes. At the moment, they currently just have a building for Danila Dilba in the Malak area, correct?
Well, yes. There's some staff that work there, but and they've still got, of course, the men's clinic and the Nucky Street clinic and so on. So, so overall, the service delivery has increased. There's no evidence to suggest that there's been any decline in service delivery by Danila Dilba. There were 2 youth projects that were that ceased at the 1st of July last year. That was the Dare to Dream and another youth services project.
Okay.
Now that's because the funding agencies in Canberra did not approve the applications, right? So the submissions were made by DDHS to keep those projects, and the funding department said no, all right? The staff who were engaged in those projects, Dare to Dream and the other youth services project, were offered redeployment, which means they were offered jobs in other parts of Danila Dilba. Most people chose to resign, now, which is their right and their choice. But you can't then come back and say to Danila Dilba that Danila Dilba did the wrong thing by you. So some people went to other jobs, some people didn't. Okay? But you also can't say there's a decline in service delivery just because a government department chooses not to fund 2 projects. You know, they also were concerned about the decline in staff numbers because a number of Aboriginal people left when those projects were closed. Okay? But staff numbers have been steadily increasing under the current board and the current CEO because they put high priority on making sure that, you know, they get as many local people employed, they get as many Aboriginal, especially those who've got qualifications like nurses and psychologists and, you know, counsellors and doctors. They've got doctors. They've got 2 Aboriginal doctors at the moment, and they've got an Aboriginal psychologist, all very experienced, and you know, that sort of training is very onerous, and we should be proud that our local service employs our own people in those roles.
It's fantastic, yeah.
And the dental service, of course, has come on stream. Now, dental health is a major issue for our people, and there's 3,000 people on the waiting list. And Danila Dilba's well aware of that and is doing everything it can to ensure that it is able to increase the capacity of the dental service to, you know, deal with that backlog.
As we were discussing earlier, you said also that there was a decline in counselling services that was brought up.
Yes, and that's true.
Okay.
Because a number of staff had chose to resign from that area of the organisation. And when I spoke to the newly recruited psychologist who runs that area, one of our own young Aboriginal women who's very competent.
Is that Tanya?
Yes.
Tanya Hervinen?
Yes.
Yeah, lovely person. We spoke to her not too long ago in the studio as well.
Great. So the listeners have already heard from Tanya, and you know she's very competent, and she was in the process of advertising for the positions to get professional counsellors in there, and also developing a new framework, a safety framework. That was good for Danila Dilba, good for the staff, and good for the clients who use the counselling service. So you've got to have standards and you've got to have qualities, and you know that's what's being brought into the counselling service. So currently they've got 6 fully qualified professional counsellors, and Tanya is the head of that unit, who's a psychologist. So Danila Dilba does have a feedback and a complaints process well in place. Mm-hmm. But any member of the organisation can walk in and see the CEO or talk to the board members. They're all community mob,
of course,
in the main, except for 2 appointed experts and a Larrakia representative, and that's a requirement of the funding conditions. And clarify. If you hear misinformation, don't go and, or you hear concerns being expressed, establish the facts. Go and talk to Olga or go and talk to board members, And if you're not satisfied or you do have a poor experience, write a complaint. It's 2016. Organisations have to be far more sophisticated and required to deliver a higher quality of service, to be accountable not only to the clients first and foremost, but they've got the community control in place in terms of the majority on their board, the vast numbers of Aboriginal staff that work there, an Aboriginal CEO, regular communications with the members. I mean, I just couldn't see anything wrong with it. People were general in saying, oh, well, governance is wrong. Well, I don't think it is. And I come from a very high-level administrative background.
Yes.
And I've worked, I've been in the cabinet room taking notes in the past on when cabinet meetings of ministers of government have been held. I've advised, prime ministers after prime ministers, plus ministers for Aboriginal Affairs and an array of other ministers in government, as well as negotiated with secretaries of departments. I ran ATSIC as the longest-serving CEO, the only CEO who was Aboriginal, the only CEO who was a woman, and the longest-serving CEO. I never had a qualified audit. I made sure that the organisation was open, transparent and fully accountable, and I did that from the regional offices to the state office to national office. And of course, I worked as the chief advisor to the Board of Commissioners and to the Minister for Aboriginal Affairs. So it was a tough gig, I've always been regarded as a straight shooter, Calum. I never, even if I'm working for people who I know very well, I deal with the issues. I'm very objective. I'm a straight shooter. I tell you straight, if you're doing something wrong, I'll tell you. Danila Dilba has gone from strength to strength under the current CEO and the current board. Now, there will be processes where, elections for board members will come about, but, and those processes will occur in due course. However, I want to assure the Aboriginal and Torres Strait Islander people living in this region that Danila Dilba is in very good hands. It is offering probably one of the best health services in Australia. It's doing a great job, and they're getting 100 new patients walking through the door every month at the moment.
That's amazing. They're doing a great job.
Yeah.
Well, speaking of your past, you've got a great list of... I don't want to say a list, it's just an amazing history. You were the Deputy Secretary for the Department of Aboriginal Affairs in Canberra, the Deputy Secretary of Department of the Prime Minister in Cabinet. Like you were saying, you were giving off advice and talking to Prime Ministers. How many Prime Ministers did you talk to?
Oh, well, I worked for every Prime Minister since Malcolm Fraser.
Oh, wow.
So I was in the government for a long time, in a senior bureaucratic role. I'd been at deputy secretary level since 1989.
What does that mean?
Well, that's second in charge of the department.
Wow, okay.
The whole department. And so I had Aboriginal Affairs, and then I went over to the Department of Prime Minister and Cabinet to oversee the establishment of the Council for Aboriginal Reconciliation, to represent the Minister at a lot of community meetings to explain the new council, advised the Minister on membership of the council, briefed backbenchers and opposition members on the legislation, briefed other government ministers on the proposed legislation before it went to Parliament. Did my other jobs, because I also had responsibility for the Office of Status of Women, for the Office of Multicultural Affairs and Corporate Services, and I had quite a lot to do with the government branch. And I took notes in Cabinet when I was required because deputies had to rotate. Okay.
You also Deputy CEO of Centrelink?
Yes, that was a massive job.
What was your involvement? So what was the...
role?
Deputy CEO, I think that's pretty big, but...
Well, Centrelink had 25,000 staff. We had the CEO and then we had a number of deputies, and I was one of them. I was responsible for, again, the Indigenous program, so it was the first thing I did when I got in there was finalise and launch the Aboriginal Reconciliation Plan for Centrelink, the first. I then did a Aboriginal and Torres Strait Islander Employment Action Strategy, which tied in the whole organisation at every level, where there were accountabilities and consequences if they didn't do the right thing. And I must say that the number of Aboriginal and Torres Strait Islander staff increased markedly while I was there.
Well, excellent.
Right across the board, you know. And then, of course, I was Deputy CEO of ATSIC.
Yeah.
And that was when the ADC and the Department of Aboriginal Affairs merged, and I was responsible for making sure that went as smoothly as possible and assisting the Minister and the Secretary or the CEO of ATSIC at that time. And then in 1994 to 98, I was the first woman, the first Aboriginal, and I was appointed for 4 years, which meant I was the longest serving CEO of ATSIC.
Excellent.
When I finished with ATSIC, I won out of 400 academics the Monash Chair in Australian Studies at Georgetown University in Washington, DC.
Yeah.
So I went to America initially for 12 months. And while I was in America, I did the 6-week business course, executive business training course at Harvard University, and passed with flying colours. I taught contemporary Australian politics and governance and Indigenous people. At Georgetown, I was the highest rated professor in the student evaluations in my faculty.
Wow.
And they wanted me to stay, so the head of the school asked Monash to extend me for a further 6 months. So I was there for 18 months and I absolutely loved it.
I'm going to be talking to you after about this. That's really very interesting to me. And you're also the inaugural CEO of the National Indigenous TV, or NITV, as everyone knows.
That's right, yes.
How did
that
work
was
out?
exciting.
So we were talking a bit earlier about that. You're saying basically in your backyard you set it up with a mobile phone and video camera?
Well, no. Well, actually, I just returned to Alice Springs with my mum, and in November. In October, I arrived, end of October. A couple of weeks later, I got a phone call. Could I project manage NITV Secretariat while they were looking for a new CEO? I said, how long is this for? You know, they said, just a couple of months over Christmas. I said, all right, you know. So I went down to Sydney. There was a little secretariat there. Most of those people were leaving except 2 part-time researchers. So I said, I'll keep you. I moved all of the records and whatever to a safe location. I went back to Alice Springs after 3 weeks, having bought myself and one of the staff, part-time researchers, a laptop and a mobile out of my own money. And I worked without pay until because I had to set up our own bank accounts. We were auspiced then by the National Aboriginal Broadcasting Organisation, but I wanted to have everything directly under NITV, so I had to set up the bank accounts and all of that. So once all of that was in place, the money was then paid directly to NITV Limited, and we were a separate company limited by guarantee, and I basically worked in Alice Springs. I'd contracted Danila McLean and to go to all the remote, or Australia-wide, to contact all of the Aboriginal media organisations to see whether they had any content that was of sufficient quality for us to show on NITV. She was about the main one. I just worked on my back veranda with my mobile and my laptop. I brought my deputy on in late March, and we were on air broadcasting to the Brax communities by July.
Fantastic. That's amazing. So, apart from your amazing history, What are you going to be working on soon or in the future?
Well, I'm supposedly retired, dear.
Oh, really?
But it's hard to say no when organisations or bodies contact me. And it really depends on, what they're looking for. And if I'm committed to that area and I have the time and it's something where I know I can make a valuable contribution, I usually, do that work.
Fantastic. Well, thank you very much for talking to us today.
You're most welcome, and I hope Larrakia Radio and TV go from strength to strength, and all the best with your business here.
Fantastic. Thank you very much.
Thank you.
You're on Larrakia Radio 94.5 FM and Aboriginal Broadcasting and Aboriginal TV. That was Pat Turner. Thank you once again.
My pleasure.